Hi, my name's Fran Beadle. I'm the National Clinical Informatics Lead for Nursing in NHS Wales. I'm also the chair of the BCS Nursing Specialist Group and the Welsh representative on the 5 countries Digital and Nursing Midwifery Leadership Group. I've come today to talk to you about the standardisation and the digitalisation of the nursing documentation across Wales, which is a national programme of work trying to cut the paper out of nursing. So why is digital important to deliver 24/7 care? And I think, as we can all appreciate, healthcare doesn't stop at 5 o'clock, and it needs to be equitable and to enable access to information to improve standards of care. Now, what that means is that that information should be available to anybody regardless of the location of the patient. It should be the same information that everybody is seeing, but also the ethos is to document once, reuse many times. There was a really important report within digital and how the adoption of digital has been somewhat lacking, and it was identified by Robert Rachter in 2016 that to enable digital adoption, it needs to be clinically driven, and in essence make IT smart for nurses, not nurses smart for IT. So some of the key lessons from that document is that there needs to be little or no training and a standardised interpretation of the language used, whether it be a nursing terminology or a coding language. So throughout our journey, our main success has been the fact that we've collaborated together, and it hasn't just been nurses, it's been project managers, technical architects, informatics, Welsh governments, therapies and directors of information and information governance leaders. So our key successes from the programme were, until the programme began, we only had one nursing informaticist across Wales, and that was myself. So we introduced a new nursing informatics role lead in every health board. And what that enabled was extensive collaboration across clinical information standards and information technology in order for us to drive the priorities and everybody work towards one goal. So those priorities were clinically driven, and they were identified from the directors of nursing, from nursing users, and from the CNO. There was input from everybody. And the idea was that those priorities then drove the national recommendations. So anytime there was a recommendation to be made, we would go out to the specialist nursing groups to ask for that recommendation to ensure that we were using the best evidence. So, and as part of that programme, we also delivered the national platform, which is known as the Welsh Nursing Care Record. And the essence of it is that you document once, reuse it many times, but the information follows the patient regardless of what ward they are on. As previously identified, one of the key things we wanted to enable was that nursing staff felt that the system was easy to use. So what we did was we made sure that when we piloted and throughout our testing and development phases, we ensured that nursing users were involved in that to make sure that it was a fit for purpose solution that they could use easily. And alongside that, we also gained leadership approvals for all of the documents. So if the documents would go through health board approvals and then back up to the nurse directors to sign them off, culminating with the issue of a Welsh Health Circular. So what we essentially did was take a bottom down and a top up approach so that we all met in the middle, and that the solution and the standards all met the needs of everybody across, all nurses across Wales. Alongside that, so now we have national risk assessments, and we also have a nursing assessment model across Wales. So we use something called the Welsh Care Domains. They, regardless of where the patient or the person may be, whether they're in primary care, secondary care, they will be using the same assessment model. So we'll be using the same nursing standardised language, and that is based on the activities of living by Logan and Tierney. So We've also identified our phase 2 priorities, because obviously 7 documents is not a huge amount of documents in the capacity of what nursing use. So we've identified the next 17 documents to be standardised, and we're actually going through that process now, standardisation, and asking for national recommendations. We've also incorporated national digital training. So one of the risk assessments, the skin risk assessments, pressure damage, was a brand new risk assessment all across Wales. We've gone with Purpose T, and the All Wales National TVN Group have developed a digital platform to do training, a more innovative training methodology, and that is available within the electronic staff record, where nursing can download it at their time, in their own time, and they will receive a certificate at the end which they can use in order to revalidate as part of a CPD training. And the other thing we did was we have piloted in every health board, and normally it's only ever done in one. So what have we learned? We've learned that there needs to be national groups to support all the recommendations. For those groups where we didn't have national groups, the time frame to do that was extensive, and also then you would have health boards saying, oh, I don't know anything about that, I wasn't involved. So moving forward, we always ensure that we have a national group to support the specialist recommendations. And keep it simple. We, in the first instance, tried to make it a bit more difficult, not on purpose, but it was. And actually, once we went out with the nursing users who started using it, we pared back and made it a lot simpler, and actually that has increased adoption in that nurses find it very easy to use, but it also reduces the needs for extensive training, therefore reducing the amount of time that nursing staff potentially have to be off the ward, away from care, because they have to attend training sessions. As I identified before, user acceptance testing. It's very important that that is enough to test the system and to ensure that everything that you, any errors can be identified, but actually to find out what is difficult to do and what is not difficult to do. And one of the other key lessons learned is do not keep changing your minds. It extends all the development phase. All you really need to do is make it safe. Don't overthink it. Have something called a minimum viable product that is enough as a starting point, because let's be realistic, it's better than paper. So what have the outcomes of standardisation achieved? Well, it's increased patient safety, and it's definitely identified better accuracy in documentation, and the documentation is a lot more complete. And also alongside that, because we've gone along the ethos of document once, reuse many times, it has increased staff capacity. And what I mean by that is that they've got more time to spend at the bedside, but actually because we have the use of iPads and digital tools, we can sit at the bedside with the patient, with the person, and actually show them and ask questions that involve them in their care. So where are we now? So we're in the process from November this year of national rollout, and you can see from this slide we have many tertiary hospitals and plus 49 community hospitals. We will be implementing this across all of those areas, and the idea will be that if a patient is transferred from one hospital to another, they do not need to restart their documentation. They will just pick up where the last hospital left off. So actually what that enables is the nurse looking after the patient to be fully informed. So where are we now? Well, after 18 months following this collaborative programme, we've engaged with executive leaders, nursing end users, and also the multidisciplinary team in order for us to achieve a national nursing standardised language. We've also got standardised evidence-based risk assessments. We've decreased the silo working by supporting a natural approach, and like I mentioned, we involve the multidisciplinary team because we are not the only people that input into patient care. We've increased the number of national specialist multidisciplinary groups to ensure that we're all talking the same and in order to follow the patient pathways through. And we've developed a fit-for-purpose digital solution that supports safe and effective care to our patients across Wales, and we've also introduced the national digital platform. We've simplified documentation and reduced the amount of documentation and thus increased the satisfaction by minimising repetitive questions. And that's not only just for nurses, that's also for patients as well, because they are quite often telling us that they're being asked the same questions multiple times by different people when ideally they've already responded to those questions. And we've also increased the adoption of technology by nursing-based users, and that has been a huge success, because actually now they feel that they are involved in the process and it's not something that is just done to them. But key to all of this has been the introduction of the new nursing informatics role, because they have been central to support the transformation, national strategy and the use of digital technology and getting the nursing documentation standards and being the expertise within nursing to translate those needs to nursing across Wales. So I just want to show you this short video of what happened during our pilot. So just wanted to take this opportunity to say thank you for listening to our journey. I'm hugely proud of what we've achieved in Wales, and I look forward to any questions that you may have, and please feel free to send them to me. Thank you.